young people, particularly students around the Blacktown and Campbelltown area. And AFL supported about 200 Aboriginal and Torres Strait Islander students in school with one-on-one mentoring and trying to support with transition into full-time study and employment. So as part of NAIDOC Week, we're going to host a morning at Blacktown International Sports Park, and it's a completely free event. We're going to have a heap of speakers and some great panelists. We will be launching this early next week, finalized with the guest speakers, but I can confirm that Associate Professor Andrew Beanie is going to be on the panel, and he's got a lot of experience with First Nations and sports participation. We've got the Deputy Director, Darius Nevin from the Aboriginal Health and Southwestern Sydney Local Health District, and Claire Beattie, Executive Business Engagement from NAB, but is on the board of PCYC and has been involved in school infrastructure. So that's going to really look at structural barriers, equity, and the role of collaboration. So we'd love, if anybody's interested, to come along to that free morning and connect. And whilst this is happening, we'll be watching the actual games on the Oval from the NAIDOC Cup. So if anybody's got any questions about that, please reach out. But the link is in the chat there as well. In terms of our evaluation and evidence of how we were able to quantify what we're actually doing as a network, we've partnered with Sydney University to put in what's called an ARC grant, which is the Australian Research Council, to look at using ripple effects mapping and social network analysis to be able to provide the evidence and quantify what we're doing. We're trying to create these conditions and networks. So that's really exciting. It's our maiden grant, so we don't know the outcome, but that would be bringing on some research assistants and a PhD student to look at supporting us over the next 3 years. We've got the symposium happening in October as well. It's on the 30th of October at Western Sydney Conference and Convention Centre. So watch out for some communications on that. We have got Blue Mountains Council on today. Western Sydney Moving's presenting at their Sports Council on Monday night, because we are looking to develop a local active partnership in the Blue Mountains as well. And as Caroline Allen spoke before, there's a few awards ceremonies tonight. So Western Sydney Moving's been shortlisted at the Zest Awards, and we're actually been shortlisted at the National Sports Convention as well, which is in a couple of weeks. So that's a real recognition to all of your support and this network. So that's a little bit of an update for me. Thank you. Probably talked a little bit more than usual, but as I mentioned at the beginning, we've got two terrific guest speakers. So I'm going to hand it over to Professor Schmitter-Shah and Kim Rizzo to talk about their wonderful initiative, SALSA. If you can just share your presentation, that would be wonderful.
Thank you, David. Okay, so here we go. And from beginning should be up and ready. If everyone can just let me know that slide. Okay, great. So before we continue, I'd just like to acknowledge that we're meeting on all different traditional Aboriginal lands. I'm meeting on the land of the Burragadigal people of the Darug Nation, and I'd like to just really emphasise that the vast majority of the work we actually do is on Darug land. I'd like to pay my respects to elders past, present, and those emerging, and extend that respect to anyone on the meeting today of Aboriginal or Torres Strait Islander backgrounds. And I recognise the lands on which we meet was, and will always be traditional Aboriginal lands. So my name is Kim. I am the project manager of the Prevention, Education and Research Unit. I do that 4 days a week, but I also work as a PDH PE teacher 1 day a week at Rudy Hill High School. And so I really do work for 2 government agencies in health and education, because I think that the greatest gains that we can see, as everyone recognises, is when we don't work in silos, but when we really establish true partnerships. And I think today that's what we're going to be able to that's what we're trying to highlight to you, is that the SALSA program is a testament of that, of when we come together for the greater good of those in our community and the benefits that it has. I will now pass over to the director of our unit and the founder of our unit, the Prevention Education and Research Unit, Professor Smita Shah, OAM.
Thank you, Kim. So before I start, I'd like to firstly thank you, David, for the invitation to be able to present our work, and really appreciate this opportunity to be able to share this work with such an amazing wide audience. The Peru, or Prevention Education and Research Unit, we're a small but a passionate team, and we are part of the Research and Education Network at Westmead Hospital. We work alongside schools and communities to empower young people in Western Sydney to make informed and healthy choices. And I just want to start, I'm a professor of public health, I'm a community physician, and I started my journey actually in pediatrics, but my journey in Western Sydney actually began in the 90s as a school medical officer in Auburn, where I first saw firsthand the value of early intervention and youth engagement. That experience led to the creation of the Prevention Education and Research Unit in 1995. So it's actually 30 years since we've been operating. And I've had the privilege of leading this unit and supported by Western Sydney Local Health District the whole time. Our unit serves the needs of the community to promote health and well-being, as well as enable young people and communities to manage and prevent chronic disease. Next slide. So we deliver several peer-led programs that build student leadership and encourage positive health behaviors. I would encourage you to check out some of our programs like Beat and Salsa Youth Voices and Health Hackathon on our website, which we will be showcasing later in the presentation. Today, we will be focusing on students as lifestyle activists, or the SALSA program. This program actually was initiated in 2004 by local doctors in the Mount Druitt area who raised the concerns about rising childhood obesity in that area. They partnered with us, as well as Rooty Hill High School, to co-create a youth-led action group. That's what became the SALSA program. The SALSA program brought together schools, healthcare professionals, educators, and researchers to prevent obesity with a strength-based, evidence-based approach. Next slide. At the heart of our work is the empowerment approach. As this quote shows, giving students a voice in shaping health solutions to create real change. By actively involving young people, they gain ownership of their health, make better decisions, and lead their peers in tackling issues like poor nutrition, inactivity, and currently increasingly saying no to vaping. This infographic captures the essence of our work in promoting student health and well-being through engagement, strength-based activities, building leadership skills and confidence, and importantly, promoting student agency. By focusing on peer education and amplifying youth voice, we achieve a significant outcomes, including increase in fruit and vegetable intake, physical activity, decreasing sugary intake, and currently the work we are doing in preventing uptake of smoking and vaping and better asthma management. All of this will be highlighted by our research officer, Katrina, later. Last year marked 20 years of the SALSA program, and what started in Western Sydney schools as a simple program became an award-winning, internationally recognized initiative that has transformed the lives of many. We'd now like to share this short video created for the anniversary, and it captures the program's journey and the voices of our dedicated school partners. Please take it away, Kim.
The SALSA program is a partnership between health and education. It has critical design features that really resonates with students. It's about motivating students to eat healthy and be more active.
The SALSA program is a research-backed healthy lifestyle peer education program led by students for students. We've seen shifts in lifestyle choices by both the Year 10s and also the Year 8 students as a result of the program.
The purpose of the program was initiated by the local GPs, and I want to acknowledge our local GP group and particularly Dr. Ken Singh, to try to do a much more preventative approach rather than trying to be reactive. And with the leadership of the GPs, Dr. Shah,
and the team at Rudy Hill High School, which included Principal Christine Causey and at the time the head teacher of PDHPE, Kathy Stewart, along with another PDHPE/English teacher, Marnie Pleffer. This is what was sent from Kathy Stewart, head teacher of PDHPE at Rudy Hill High School at the time. It's hard to believe that 20 years ago, a few meetings between a doggedly determined Smita Shah and a PDHPE faculty would result in a successful collaboration to last for 20 years and into the future. Congratulations, Smita, Kim and the team on your vision, resilience and stamina, and the goal of improving the health outcomes of New South Wales students through peer leadership continues to be a high priority.
My most memorable SALSA experience was the Youth Action Day, where we had to come together and plan something to implement into our school.
It was interesting to see what other schools had come up with as well.
It gave me a lot of leadership skills and gave me the confidence to become the principal's rep.
I definitely recommend the SALSA program for other students. I've really been able to apply these skills into the leadership role that I have in the school's cultural group called the Haka Warriors.
What I valued was I was able to teach and learn at the same time.
I did like that a lot, and it did make me want to pursue an education career.
It's very empowering to be in a position where you get to motivate younger students.
As a coordinating teacher for SALSA this year, there's been many memorable moments. We had over 50 applications to be a SALSA leader, lots from students who thought they weren't leaders, but after completing the training, they saw that leadership potential in themselves. It was fantastic to see students take on these opportunities and now seeking more leadership opportunities.
It's wonderful to be celebrating 20 years of the SALSA Students as Lifestyle Activists program, and to be able to recognise the commitment of Western Sydney Local Health District, the Sydney University School of Public Health, and particularly the leadership of Dr. Smita Shah and her team.
20 years on, it's crazy how time flies. I think I've been a part of about 17 of those 20 years. Just glad that I was able to contribute along the journey and to see it flourish and expand, not only around the state but around the world, is a testament to Smita and the work of her team and all the schools that are involved.
we're not adding anything that's not being done at the school. All we're doing is coming in and complementing what's being done at the school, and that's what I think sets it apart. But not only that, it's driven from a community level already.
This is a program that's been researched, it has evidence, and a fair bit of academic data suggest that peer-led programs in health prevention really matter, and that engaging schools as partners in those projects matters too.
Working with schools in delivering the SALSA program over the 20 years has been one of the highlights of my career. And what's more exciting is that now we are going to be able to take the program to rural communities across Australia.
Hey, that actually, thank you to Kim, who helped make this video, and the Rooty Hill High School that helped us make this video. And it just showcases what the impact of a program which is driven through the community can do. Importantly, just some data that we've collected. We have trained over 640 university students who have been trained as SALSA educators, and they go into our high schools and work with the year 10 students. And they've reached over 27,000 high school students across 50 of our schools. The program's impact has been extended internationally as well.
How's it going, mate?
Okay. And has been piloted in Middle East schools in Jordan through a PhD student of mine. And in Vietnam, we worked with the medical students in Ho Chi Minh City who actually took on the program into their schools in a way that they put us to shame, because they actually designed T-shirts, they designed kits, and they designed they had these packs of food to take into the school. So they did amazing. They actually did their own thing too. It has been also recognized by UNICEF as a good practice program for adolescent health. So all of this work has come from our schools in Western Sydney. Importantly, we have established key partnerships to implement the SALSA program in rural New South Wales, and especially with HealthWise and Murrumbidgee Primary Health Network. And the program's expansion is a testament to its adaptability and its effectiveness. Next slide. So why invest in adolescents? And I think those of you that know UNET, and especially myself, we are passionate about young people. As highlighted in the Lancet Commission, improving adolescent health yields both social and economic benefits that last a lifetime. This slide here, which was taken from the Lancet Commission, and a colleague of mine, Professor Susan Sawyer, designed this, reinforces the importance of focusing on adolescents when we think about long-term health outcomes. By investing in adolescent health, we are not only setting up young people for success, but we're also influencing their health for future adults and children. It's a generational ripple effect. And I think, David, you really liked using the word ripple effect. Well, we also like to do that, and we do that in our schools. Healthy adolescents means they're more likely to become healthy, productive adults, and they are also more likely to raise healthy children. And that is why prevention like SALSA are also prevention programs like the SALSA program are so powerful, because they support adolescents during a critical window when lifelong behaviors are being formed. We mentioned in the video, it's been mentioned about peer-led health education. That's the research I did in '95. It's my master's in community health at Sydney University. And what we found is that peer education is key to ensuring behavior change in young people. And that's what our schools wanted. When we asked the students and staff and parents, how would they like the programs, they all actually mentioned about peer education and getting younger, older students to work with younger students. And there are many reasons why it can be more effective, especially when it complements the teaching and learning programs within the school settings. Importantly, they ensure language and information is relevant, and this is key, especially in health literacy for young people. Learning has to always needs to be fun. That's one of the things I learned very early on, especially on health education. If we are going to go into schools, we need to make sure that we can actually engage young people. It reaches larger numbers. Importantly, it also develops leadership and communication skills in those who are actually doing the teaching, and they learn through teaching. And it reaches, it actually accesses some of the marginalized students, because normally when you're doing health education, you have the students in the front row listening to you and the others fiddling around. The way we work in peer education and empowerment process, every single student gets involved and there is no sitting in the back. At this stage, I will now let Kim detail the SALSA program and how it works in schools. Take it away, Kim, please.
Yeah, I just want to also let the team know that there's like 7 minutes left in this presentation for 25 minutes. Okay, so like, what is SALSA program? So SALSA program is a peer-led leadership program that motivates students to increase physical activity and improve diet. So what is involved? It's a one-day workshop at a school. You get about 30 year 10 students. They're trained as SALSA peer leaders. They deliver lessons. So I'm going to look at the steps. Oh, the steps are on the next page. Okay. Oh, okay. So I'm just going to go first. I didn't realize. So why do we need SALSA? So, I mean, it's not a surprise to anyone here, but we look at the statistics and we know that 83% of young people do not meet physical activity recommendations for those who are 15 to 17. So what are some of the things that we can do? Well, obviously in schools, we provide knowledge. Kids know about the things that they need to do, but we need to recognise that in some cases, the physical environment is not always conducive to encouraging physical activity and sport. And there's things like cost, transport to and from sport. So one of the ways we can do this is to empower students at their schools to get involved and complement what's being done. So how does the SALSA program work? I've talked about it briefly on the other slide. It is a 3-step process. In step 1, the SALSA educators train peer leaders. You're probably saying, who are the SALSA educators? They're university students. We train them on a day. In step 2, the peer leaders then go into year 8 classrooms, can be year 7, and they deliver 4 times 60-minute lessons. Then in step 3, we're seeing the SALSA peer leaders really working through their SMART goal and their school action plan. All of the students do this as part of lesson 4, but we really emphasize it with the year 10s, especially on the school action plan, by providing them with an additional opportunity called SALSA Youth Voices. So what is SALSA Youth Voices? Well, it's afforded to every single school that participates in the SALSA program. It's an additional leadership opportunity. That's a 2-part process. Part 1, students get involved in a leadership day, and that's run at GWS, and it's really, really fun. You can imagine for the students seeing elite athletes, but it culminates in the students coming up with their school action plan and what they want to implement at their school. In part 2, it is the action day. And we're going to talk about those actions a little bit more, but I just wanted to just emphasize, obviously here, this is a socio-ecological approach to behaviour change. Kat does have some results, and I want to give us some time because I'm looking at the time here. Okay, so what are the SALSA peer leader actions? So interestingly, we looked at the statistics, the need for SALSA. Okay, and when we're looking at the need for SALSA, we know that a lot of young people are not meeting physical activity. So what are the students are wanting to do? We've seen in the last few years, it's all about physical activity interventions. And so all of these pictures here give you a representation of what it is that the students did at their school, what they delivered for the whole school body, and that's reaching large numbers. again, not wanting to waste time, Kat will put a video in the chat. Please watch it. It is a fantastic representation of the students and how they're empowered. I'll pass it over to Kat.
Thanks, Kim. So I'm the research officer for Peru, and I'll try and get through this as quick as possible. So over the years,
There's no
SALSA
need to
has
rush.
been... Okay, cool. So over the years, the SALSA program has been extensively evaluated, and we do this in alignment with the school's priorities, and we've also done it with funding support from the Federal Department of Health and Aged Care and Wentwest, which supports my position. So in 2014 and 15, we conducted a process and impact evaluation of the SALSA program among our Year 10 and Year 8 students, and we did this across 23 high schools in Western Sydney. So on the right-hand side, we can see the results from this study. And after participating in SALSA, there were significant increases in the proportion of students who are meeting the Australian Dietary and Physical Activity Guidelines. And in the research study, we also found that the SALSA program is not only effective in promoting behaviour change, but it's also highly cost effective at less than $10 per student. And as part of our ongoing partnership with schools and ensuring that we do evidence-based practice, we continue to monitor and evaluate the program, which is part of my job. And we do this by collecting data from our peer leaders using a simple pre-post questionnaire and by routinely conducting debrief sessions at the conclusion of the program in each school. So on the left-hand side, we can see the evaluation results from last year, which have demonstrated continued positive impacts on peer leaders' fruit and vegetable intake, sugary beverage consumption, and physical activity levels. And I think what's important here is that SALSA works and it continues to do so in real world settings, and it really bridges the translation gap between research and practice. Next slide, please. And so one way that we promote transparency and ownership of the program at the community level is also by providing schools with individual reports on how the program is performing in their school. And this slide gives a little taster of what that actually looks like. So for example, this is one of the reports that we shared with the principal at Rooty Hill High School. And it shows that by participating in the program, the peer leaders enhanced their work-ready skills, they were empowered to make small positive changes to their health, and that they also reported a range of gains. And this was a really interesting school, so they reported things like trust, responsibility, friendship, and empathy, which is really promising. So next slide, Kim. Yep, perfect. And while we haven't conducted a formal research study to determine the long-term impact of the SALSA program and how it ripples throughout the community, we do have some anecdotal evidence to show for it. So here we have a quote from Dharma, who participated in the SALSA program as a Year 8 student, then a peer leader, a university educator, and is now pursuing a career in medicine. In the interest of time, I won't read it out loud. But as being an ex-SALSA educator myself, I can vouch for Dharma's experience and say that the SALSA program has definitely played a role in igniting my passion for working with young people to advance health equity, and has now inspired me to do my own PhD in evaluating the BEAT program. And I'll let Kim speak here because I was still in primary school in 2006.
That was when I had my oldest son. How scary is that? Okay, David, how much time? I'm just don't want to take up too much.
Yeah, good. All good. Carry on.
All good. Okay, great.
5-10 minutes. You're all right.
Okay, great. Thanks for that, David, and thanks to everyone for listening and being patient with us. But we've got so much to share with you. So, you know, you look at this photo here, and for me, I was part of the school at this time. So I started at Rooty Hill in 2002. And so I see these faces and I know these faces. These are some of the original SALSA peer leaders. And when we look at them and where they are now, it's quite interesting that, you know, 6 of them work in healthcare. 4 of them are registered nurses. 1 of them's a pediatric nurse. 1 of them, actually on the far right at the bottom, is a performer. She was in The Lion King and she's done other theatre productions as well. We have police officer, teacher. There's a lot of different students doing, if we were to measure, like Kat said, the long-term benefits of SALSA and follow them up, we would see what these young people are doing and the impact that they're having now. I guess you can't really call them young anymore. But I just wanted to point out, you might ask what comes first, as Smita did, the chicken or the egg, and that's quite interesting. But what we do see is that when schools have very strong support systems in place and they then complement what's being done at the school with programs like the SALSA program, it really does, you know, add to the student experience and potentially could shape them to be inspired to pursue a healthcare career. So how do we know it works? So we've looked at the program sustainability tool, and I think everyone knows what this tool is, and we've got lots of different aspects in it. And so we know that the SALSA program works. So first of all, as mentioned by Smita, it was grassroots and community driven. It wasn't something that came in from New South Wales Health or someone else saying, this is what we want to do. No, it was actually driven from the community themselves. So it was that grassroots approach. Funding stability. So it has been sustained in Western Sydney schools, as Smita said, 20 years. So what started with no funding but lots of passion is still continued. So despite this, we know that the program, so we are aware, sorry, I'm just reading my notes, increased funding is important for the scaling of the program. But despite this, we know that it will continue in Western Sydney because of the support of Western Sydney Local Health District and Went West. Partnerships have been there from the beginning, and we're starting to establish more partnerships such as the HealthWise, which Smita spoke about. State staff capability, we definitely have a small team, but a very capable team. In saying that, we're looking for support to be able to expand our capacity because we've got the capability, but we just need that little bit extra support to, like I said, really have the capacity, because at the moment we're at the tipping point. Kat already talked about the ongoing monitoring of the program, so I'm not going to touch on that. Okay, and if we're looking at the program adaptation, we debrief every year with the students, and we've actually made changes in the SALSA Peer Leader program or in the manual to be able to complement what the students are asking. So for example, changing a video, putting in another physical activity, because they said they needed to run more. When we're looking at communication, Kat has already said it, but you know, a report goes back every year to the schools, and that's really important for transparent and being accountable with the schools. And the schools obviously have their own school plans, and so they need to speak to whatever they're getting to come into their school is actually adding value to the school and value to the teachers. So by us being able to provide this, we can ensure that. And then when we look at scale up and succession planning, well, actually, as part of the strategic planning, I wasn't there, but Smita added in 2018 the SALSA Youth Voices. We also then developed the SALSA Kit, which we implemented in 2020 to 2021. And at present, we're looking for support to be able to write up the process behind implementing the SALSA program. As I said, we've really worked very well with the Northwest, and Smita will speak a little bit more to that in the next couple of slides. Back to you, Smita. You're on mute.
Okay. Hi, can everyone listen, hear us? Because somebody said that they've lost sound.
Yes, we can hear you.
Okay. Thank you, Kim. And now just the final part. What have been the learnings from the SALSA program? As you know, over the past 20 years, the SALSA program has taught us several valuable lessons about what works in school-based prevention. What has been highlighted is community-driven grassroots approach, and this is the work Western Sydney, what David is doing in Western Sydney moving as well. The success of SALSA has always come from the deep community engagement and the passion of our teachers, our principals, students, and even our local doctors, starting with local schools and doctors and passionate individuals again. Starting with no funding, as what Kim's mentioned, volunteerism has been key to the SALSA program. And this has been when I think Jackie Lambie talks about volunteerism in Australia, I think we create a lot of volunteerism in Western Sydney. Short-term gains and long-term impacts. While the students show immediate improvements in their health behaviors, we believe that many of these behaviors are sustained over time. And many of the students that we meet later on say to us that the impact of the SALSA program has been lifelong. A cost-effective approach, making it a perfect candidate for scaling. As we've just highlighted, most of the work is done by volunteers, volunteer university students, and volunteer high school students. And we think it's a very cost-effective program which we have hosted, and we've also published on that. It only costs $10 per student to be able to run this program in schools, although our program is offered free to every school in Australia currently. And it has been proven, the proven impact in both rural schools as well as in the wider rollout has been shown very much. Okay, so now the final slide. How can we, all of us, this group that David has set up, how can we work together? What we want to just share with you, this jigsaw, what we see, and let me just get this right. First of all, we want to package the program for a scale up, and we are looking out to get some support and funding to make a train the trainer package so that basically anyone who wants to run it can be able to, once they are trained, they are able to run it in their schools. Importantly, we want to also work together to engage the community with other organizations to reach families and especially parents and grandparents. We haven't managed to do that, and this is an area that we would love to see how we can work with communities in Western Sydney to see how we can actually better reach families, especially from Akal communities. And we are doing some work with multicultural health in that area, and just wait and see later on. We are running a program with parents and grandparents. And supporting student actions, as Kim's already mentioned. Until now, our local Doctors Association, the Blacktown Doctors Association, Mount Druitt Medical Practitioners Association, and the Hills Doctors Associations have been supporting student actions. But we are looking for some worthwhile community groups to help support more student actions in our groups. One of the things that I think you've heard me say that before when David at the last presentation, that private schools receive quite a bit of funding. Our public schools do not have the same playgrounds, as well as they don't have the same resources. We need to have more equity in our schools, and this is where we are pushing through student leadership and expand. Of course, it would like to expand the reach in Western Sydney and beyond, but we can't do that until we can attract more funding and have more partners. Before we finish, we'd really like to acknowledge our funding support and partners. Most importantly, and our primary supporters have been Western Sydney Primary Health Network. They've been supporting us for over 10 years, and without their support, we would not be able to do the evaluation and the research that we are able to do every year. And I really want to acknowledge that. We've had some philanthropy from Daniel McCullery and his family. He's a farmer in Glen Innes, but he's seen the importance of our work and has really supported us. And as of even yesterday, he has just given us a substantial, at least a little bit of amount of money to make sure we continue with our staff. And last year, the New South Wales Department of Education supported us through Prue Carr and also through Jason Mises. We got some funding to continue our work. Our partners, without our partners, we wouldn't be around. So again, the logos down there, our partners include Primary Health Network, the University of Sydney, the Doctors Associations. I've mentioned the GWS Giants and the rural communities, Murrumbidgee and Healthwise. Next slide.
I'm just aware of time, David. Do you need us to stop because we can send the other information in an email?
Yeah,
that would be great.
That would be great. Okay, yeah, I'll do that. I'll stop sharing, everyone.
Thank you so much for that. Such an inspiring, presentation and very comprehensive. Just love the work that you all do. And, Western Sydney Moving isn't about duplicating. It's about how we can illuminate what is going well and trying to expand it and provide the connections. So I'm really thrilled for you to be able to share what is a wonderful story and impact. But I just wanted to open it up for 5 minutes before then at the end, we'll give anybody an opportunity to share anything that is top of mind. But yeah, if anybody wants to ask any questions, just put your hand up and we'll come straight to you. I'll ask one. Oh, go on, Jeff. Dr. Jeff Walkley, Belgravia Leisure, over to you. You're just on mute, I think, Jeff.
Thank you, David. My apologies to everyone. Commendable presentation and great work. Very interested, given that I work in the community sector in leisure centres, aquatic centres, recreation, sports facilities across Australia, for an early response to the adaptability of the SALSA model to a community organisation. In our community network forums that we hold twice yearly, supporting youth has come up as the #1 priorities in communities across Australia.
Thank you, Jeff. I think that for sharing that. Why don't we talk outside of this meeting and communicate and look at what we can actually do? Maybe I was talking to David earlier on. We could all put in for a local community. You guys could put in for a local community grant, and we could actually look at how the SALSA program can be adapted for centers like yours. And we'd be very happy to share and work with you on that.
Thank you. I've just put my email address and we'll contact each other.
Right.
Thank you. Anybody else got any questions? Yes, Marilyn. Southwestern.
Yes, thank you very much. I think similar to Jeff, I might want to say we also work with communities. So it would be worth having a chat with you, Smita, because we work across the whole lifespan from young babies to seniors. So we could have a conversation probably to see how we can collaborate.
Thank you, Marilyn. Again, what I'd like to suggest, David, is that maybe we could, outside of this, look at working together with David, yourselves and all, and to see how we can actually make this happen. We do, as I said, at present, we're just looking at capacity. We are at full capacity, but we can always take on more. And as a community medical officer, I love working with community, and I think it's really important that we get those messages out in the community. So really, let's, Katrina, can you put our email addresses so that people can contact us?
Yeah, all right. Thank you.
David, you had a question for us.
Yeah, just quickly. It was just in regards to what can this network do for you? I think you've kind of answered most of that. But yeah, you've got quite part of the system here, and we want to support the work that you're doing.
I think Kim can answer that. She actually had summarized. We were talking about what can the network do. Kim, do you want to just talk on that, please?
Okay, so yeah, when we were having the conversation, what it would be really great is to have your support whenever we were going maybe for a grant or something. So just to have your backing on that, to be able to support the work that we do. So something like a yeah, a support of that. Smita, that was what I had said. And obviously, David, there's more ideas outside of that, but not really relevant to the SALSA program right now.
Yeah. Okay, well,
and
I'll
also
just wrap
offering more schools as well. If there are more contacts with other schools, we are very happy to get university students going out to those schools.
Yeah, let's double that 50 skills to 100 in the next few years. So thank you so much for that presentation. Really appreciate it. The last 8 minutes that we've got now is really the opportunity for anybody just to share what's front of mind. If there's anywhere we can help you, any events or anything happening in your neck of the woods, yeah, would love to hear from any of you.
Can we take those emails?
David, can I just mention our street soccer? So
thanks, Jen.
We have a few different street soccer programs running in Western Sydney, and we're hoping to expand and add a couple more. We've currently got one in Mount Druitt at the Town Centre Reserve every Tuesday from 1 till 3. We're sort of wanting to revamp that a bit and sort of open that up. Some of the agencies that have been coming to us have closed or have changed. So we're sort of at that stage where we're wanting to make some more contacts of we're just free, open community soccer. It's very relaxed, not competitive. You don't have to commit to coming to a certain number of sessions. We are just sort of consistently there, and people can come and join us when they can and be part of just sort of running around. You don't need to have any soccer skills. Yes, I can. I just saw a question asking. I'll put a link in the comments about our street soccer programs. The Parramatta one, we've had a little bit of location movement, so we changed to Robin Thomas Reserve, and then that's being renovated at the moment, so we've gone back to Parramatta Park. So I think we've lost a little bit of momentum there. That's on a Thursday afternoon, so we'd like to also sort of spread the word about that. And we're wanting to start a new Western Sydney women's program, because we've found that most of our programs, although they're mixed, they're open to everybody. Sometimes women are a bit put off by the amount of men that are there, or they find that a bit intimidating, particularly if they've not played soccer before, and sort of, for many other reasons. We needed a safe space for women. We've got one that's just started in the city, and so now we're wanting to do one in the west. We're currently talking to the Western Sydney Migrant Resource Centre in Liverpool about sort of joining with some of their activity programs, but we're also open to any other ideas. Like, we've been given quite a broad scope of it can just be in Western Sydney, so we've been looking Mount Druitt, Liverpool, but even maybe Auburn or Fairfield. So if anybody has sort of ideas or contacts or would like to chat about that, that would be great. That's me. I'll put in the links.
Fantastic,
into
Jennifer.
the chat
That
so
sounds so exciting. Love to continue the conversation with that one. Thank you. Anybody else like to share anything? Jeff, do you want to talk about your conference that you're going to be putting on later in the year? Would that be helpful?
Look, happy to do that, David. As part of a collaboration with Collective Leisure, of which David is intricately involved in its leadership, AusActive, Royal Life Saving Society Australia, Pride in Sport, and Aquatics and Recreation Institute New South Wales, we are undertaking preparatory work for a diversity and inclusion in leisure, aquatics, recreation forum to be held in the latter part of this year in Sydney. We have run that successfully for 3 years in Melbourne, and the notion is translation of evidence-based practice and its scale up. And the presentations follow a TEDx format. It is established based on needs assessment completed throughout the sector. There is a survey circulating at the moment related to the needs of the aquatic, recreation, leisure and fitness sector in New South Wales. We're gathering information, and David and myself and those others, representatives from those other organisations, are meeting regularly in preparation for that. If anyone wishes to receive a copy of that survey for cross-posting or completion themselves, please alert myself or David, and we will send a link to you directly. My email is in the chat of this meeting. Thank you, David.
Thank you. Yeah, it's very exciting, Jeff, for sport the leisure industry. Anybody else like to add anything? Is Christian there? Whitaker, by any chance? No. Well, if no one else has got anything to say, I think for me, I just wanted to, a big thank you to Kim, Katriana, and Schmidt Shah OAM, by the way, for that great presentation. And yeah, really looking forward to seeing how we can support you moving forward. If anybody else would like to, present one of the community of practices, in the foreseeable future, please let me know. We obviously want to promote what you all are doing, and we would love to see those that could make it at the AFL NAIDOC Cup event. As I mentioned earlier on, it's a free event that will be in Blacktown International Sports Park on the 2nd of July, where we're bringing in health, sport, government on a panel to talk about how we can support our First Nations and Torres Strait Aboriginal and Torres Strait Islander people. And yeah, it should be a really good event. And we continue to develop the local active partnerships, where we're trying to build that local coalition. So Jennifer, what you were talking about there, we'd love you if you were able to maybe present at the next local active partnership on the ground, because we're looking at tailoring solutions to local challenges. So that would be really great. Lastly, does anybody any final words from anybody? Otherwise, it's 10:30 and we'll let you ease into your day. But again, thank you for our presenters today and for everybody just showing up. I know you're all busy. We really appreciate it as we continue this movement for movement. So thank you very much, and I'll see you all soon. Bye, everybody.
Take care all. Bye-bye.
Thanks, David.
Bye. You're welcome, Caroline. See you tonight.
See you later. Thanks. Bye.
Bye. Well done. Well done, Schmidt.
Thank you, David. So I'm sorry we did take a bit long. I was very passionate about showing the video.
That's okay. So
and that took that took longer. But that I just think the video makes a big difference for people to be able to see or hear the voices of young people.
Yeah, exactly. No, I wanted to give you the space, so it's all good.